Thank you for tuning in to Just Conversations, Indigenous Teachings for Recovery and Reform. This is a 3-part podcast series highlighting Indigenous-led organizations working to improve justice outcomes in their communities. Episode 1, The Lay of the Land. This episode will introduce our interviewees, their organizations, and the work they do. Today we have Christina Andrews from the Carlos Montezuma Center for Native American Health at the University of Arizona, Monica Bailey with South Dakota Urban Indian Health's Wo'okie Street Outreach Team, and Johnny Chavez with Voices of Change's Sacred Traditions Program. My name is Wynn Mackay from the Justice Management Institute. These organizations are all members of the Witch-a-Yankee Native American Network, a convening of Indigenous community leaders and justice professionals with an interest in eliminating racial disparities and combating the intergenerational effects of oppression within local criminal justice systems. The Just Conversations, Indigenous Teachings for Recovery and Reform podcast series, as well as the Witch-a-Yankee Network, was created with support from the John D. and Catherine T. MacArthur Foundation as part of the Safety Justice Challebge, which seeks to reduce over-incarceration by changing the way America thinks about and uses jails. To learn more about the Safety Justice Challebge, visit safetyandjusticechallenge.org. To learn more about the Witch-a-Yankee Network, visit jmijustice.org and select Native American Network from the Connected Communities tab, or visit the links in the description. All right, just to start us off, we're just going to go through with introductions. So one by one, if you each could introduce yourselves and your program, as well as what kind of services your organization provides. And Christina, we will start off with you.
Hi, everyone. My name is Christina Andrews. I am Hiachet O'odham, which are the Sand people here in the Sonoran Southwest. I am a member of the O'odham Nation, which are the desert people. And I am also Pascua-Yaqui on my father's side. I am the executive director and also assistant professor for the Wasatch Carlos Montezuma Center for Native American Health at the University of Arizona under the College of Medicine. And the services that we provide, we are Indigenous-led. And what that means is that we have an advisory council made up of tribal members who are champions in their community, and they're from different backgrounds. But they're basically driving the bus for the Wasatch Center. And you could think of me as just their secretary, if you want to call that. What we do right now is looking at basically indigenizing the academic institution, but trying to respect the sovereignty of the tribes. What we know is important for us is to grow our own people, to get our people employed, as well as looking at the social justice of historical and generational trauma with boarding schools, MMIP, as well as looking at the physical body in terms of issues that affect us like diabetes, etc., and our mental health as well. But more than anything, what we are looking to do is to protect our Indigenous knowledge through law and policy. So that is the Wasatch Carlos Montezuma Center.
Thank you, Christina. Monica, if you could also just introduce yourself, your program, and the services that you guys provide.
Hi, my name is Monica Bailey. I'm an enrolled member of the Standing Rock Sioux tribe and also a part of the Turtle Mountain Band of Chippewa. That's from the North and South Dakota. I am a grant project manager at South Dakota Urban Indian Health, which is a federally qualified health center and a 501c3 nonprofit. We have 2 clinics, one in Pierre and one in Sioux Falls, and our clinics have medical, behavioral health, and cultural health. And specifically what I manage is the Wo'okie project, which is a street outreach program designed to provide culturally sensitive wraparound services, really aiming to create a safe and non-judgmental space for our unhoused relatives so they can access support. There is a high population of our Native relatives in the justice system, so to ensure that they receive wraparound care as well. But not only does our street outreach team provide wraparound services, we also provide an alternative to calling the police for low-level, low-risk situations to make sure our relatives receive care that they need without really escalating a situation.
Awesome. Thank you, Monica. And Johnny, if you could wrap us up, please.
Well, my name is Dr. Johnny G. Chavez III. I'm the CEO and founder of Voices of Change, LLC, based out of Tucson, Arizona. And we are focused on empowering marginalized people to overcome the cycles of poverty and incarceration through education and literacy programs. One of the programs that we've developed in the last couple of years is our Sacred Traditions program, which focuses on helping individuals reconnect with their spirituality and sacred traditions. It is primarily targeted at Indigenous people. However, anyone can participate in the program, facilitate the program. And one of the greatest things is that we are offering it at no cost to both the facilitators and the participants, with the only small cost would be the manuals if they choose to. And if not, then, we offer them a PDF version and then they can print the materials themselves. So the idea is to keep it as low a cost as possible and help people recover. The reason why we got involved with this was because I spent 28 years in the field of corrections, working both state and federal prison systems. And one of the things that I noticed over that time was that there was a lack of programming for Indigenous people, and there was no way for them to reconnect with their spirituality and their sacred traditions to get back into, a healthy lifestyle. Many of those individuals have been disconnected, may not even live in the reservations, and really just don't have any way to really get back to a foundational basis. And, our belief is that if we can help you get spiritually grounded and find a way back, that you will be able to heal and recover.
Thank you all so much. So for this next question, I just wanted to get a little bit more of a background about you all as individuals and kind of your background, life story, and what led you all to this work.
So that's a really great question there. And I say that because I kind of look at myself as being a very complicated person. I'm older, okay? I'm 54. I come from a place where it's a lot of struggle. Our family grew up very homeless. When I say that, we lived out of cars. We also lived in hotels. There was, of course, a lot of family living in one house, for example. So there was, sexual abuse, and there was, a lot of the issues that we deal with as tribal people. So my background is not at all heavily educated, I guess. And I think most people would be surprised because I do have a bachelor's of science in Spanish and Portuguese. I have a master's in English at the U of A, as well as an MBA in international business and a master's of public health. I also have my Juris Doctorate from Saunderdale Connor College of Law at Arizona State University, where I also have a certificate in federal Indian law. I really shouldn't be where I am, to be honest, but I am here. And that's one of the reasons why I am passionate doing what I do, because I understand and I know what kind of challenges as Native Americans that we face. I spent 25 plus years in Indian country at the tribal, state, and federal level because our tribe crosses into Mexico and the United States. We have members on both sides. I was also the health director of tribal social services as well as physical health department for the Tohono O'odham Nation. So I got to see at a grassroots level the issues that we experience in my position. And also as a tribal leader, I was the chairwoman of one of the districts of the Tohono O'odham Nation. I also had the experience of assisting at the prosecutors as well as becoming a judicial law clerk for judges in the juvenile sector here in Pima County. But at that time in 2020, we were looking at the Indian Child Welfare Act. So with that, I assisted in the creation of the Indian Child Welfare Act courts here at Pima County, which has now been a model for the United States for other state IPWA courts. And currently, I am the Assistant Tohono O'odham Legislative Council alternate. And I say with my education, my experience, and with my knowledge being at the grassroots level, I've had wonderful experiences with great people, and their hearts are in that position with their tribes. And so we all came together, and that's how the Wasajo was formed, because I knew that we can do it, one, and two, we know what we need and what we want. But it always comes out like the Western concepts, they know what we need and what we want. No, we know what we need and how to do it. We need to feel protected. So with that, I'm here now and I really want to assist in how do we do this? I know we can do it. And that's what has led me, my personal life, my education, as well as my experience with tribes, not only my personal tribe, but tribes across the United States to be where I'm at today.
It sounds like you have had a long, dedicated journey, Christina, but, I always find that really just seems to strengthen the work, being able to pull from such a diverse array of experiences and people you've met along the way. So it sounds like you really know what you're doing and you're able to draw from a lot in the work that you're doing. So that's really great to hear. Monica, same question for you.
Yeah, I have my bachelor's from Augustana University, which is here in Sioux Falls. How I came to South Dakota Urban Indian Health was actually just looking for a sense of community here in Sioux Falls. So like many other urban natives, I was feeling very disconnected from my family and my culture because they're 5 hours away from me. So I just wanted to join the community here in Sioux Falls because I felt disconnected and I felt like I really needed that at that time in my life. So I went to their page because I knew that they had a cultural health program here. And I wanted to see what kind of activities they were hosting. And they were hosting things like beading and sewing on the weekdays. They had Red Row Talking Circle. They had all of these cultural things and events that they hosted. And while I was looking there, I was like, let me just look at their job postings. And I happened to see that they were listing for a grant project manager. And the description really felt like personal to me because it would be managing this project. And what Wo'okie means in the Lakota and Dakota language is to help or assist. So to help the people. And I'm like, what better way to get involved in my community than by helping? I mean, that's really what is ingrained in us as Native people is to help one another, to be a good relative. So it just felt like it just was meant to be. And so I applied and that's how I stumbled upon Urban. I was really just looking for a sense of community. And I will say, working here, I have found that because I work with other Indigenous people, other urban natives, and we're all doing the work because we all want to help our people and we get to work every day with our people. So that makes it really special.
Fantastic, Monica. Thank you. That is definitely such a special, heartfelt story. I love every time that you share that and I get to hear more about it. And Johnny, if you can just share about how you got involved with Voices of Change.
Sure. My journey was kind of a very long one. Back in 1995, I had an Insta family and I needed a new job, a way to make some extra funds to support myself. And, at this time, my son's mother and my stepdaughter at the time. So after speaking with my uncle and going back and forth, I guess you could say, I joined the Department of Corrections in New Mexico and I went to work at the penitentiary in Santa Fe, the old main facility. And I spent 4 years there, initially, and that was a pretty rough system. But for some reason, it wasn't my first choice, but I found out I was pretty good because it's dealing with people and talking with people and helping people, get through their lives and their problems and those types of things and hopefully become better people. And at that time, my father had retired from the military after 25 years and was a vocational automotive instructor at the Federal Correctional Institute, Tuna in Anthony, Texas. And he said, hey, I've been talking to these individuals and they said, hey, you can make more money by going to the Bureau. So I thought it'd be a good opportunity to try to get back home to Anthony, Texas, because my parents lived right in that area. And I did get picked up by the Bureau of Prisons in February of 1999, and I went to Florence, Colorado instead, to the United States Penitentiary there. I spent my first 10 years there, moved up in various series of positions of responsibility. I was a criminal investigator, lieutenant, a special investigative agent, and then from there, I was promoted and I went to Littleton, Colorado, where I was stationed as the captain at the Federal Correctional Institute in Inglewood, Colorado. I spent 3 years there and then transferred over to our Management and Staff Training Center at Aurora, Colorado. I spent 3 years there. Finally got a chance to go to FCI La Tuna in Anthony, Texas. I was there for 4 years as an executive assistant. Went out to Bastrop, Texas. They got promoted to an associate warden. And then from there, came out for my second tour as an associate warden out at the Federal Correctional Complex in Tucson, where I was at the Federal Correctional Institute. During that time period, especially when I was at La Tuna, that's when I developed our first program, Voices of Change. And it was just a way to help the incarcerated individual reconnect with their family through poetry and storytelling. We brought down Jimmy Santiago Baca and had him give a 2-hour session with about 45 of our individuals. And from that, myself and the reentry coordinator met and said, hey, do you guys like this program? Well, we'd like to continue it. And over the next 8 months, we developed the curriculum for the program. And it took a little while for us to get it into a book form. But when I finally got here to Tucson, I was using it at the FCI because we were in the middle of COVID and there was no volunteers, no programming. So I said, well, I got a program, I'll run it. And so I ran about 4 sessions with the individuals at that facility. And interesting enough, they were all gang dropouts from across the country. The Federal Correctional Institute at that time was the only gang designated dropout yard in the country. And so we had Bloods, Crips, MS-13s, Mexicanami, you name it, they were there. And I had all these individuals in the same class, and it really broke down barriers between them and really helped them grow. And they got a different perspective on life and what they can achieve. But, there was still that lack of programming for Indigenous people. And this came to light because of COVID. One of the things is all the other faith groups were able to, after some time, participate in programming. But when it came to Indigenous and some of the other, what the Bureau classifies as pagan faiths, were not given that same opportunity. And they were denied to participate in basic ceremonies and worship. So it really bothered me, especially since I am of Tiwa descent from Tortugas Pueblos, part of the Secta de Sur in El Paso. And it really reached out to my heart, I should say, for me to do something. And that's how I began kind of conceptualizing the concept for sacred traditions and putting it together. And, it's done really great so far. During that time period, I could say, just to digress just a bit, my background, not only was corrections, but I went back to school, finished my bachelor's in management, went on and got my master's in IT management, because I had one time at big aspirations to become an IT manager, and my career went a different direction. And then I finally got my doctorate in management. And I think through that education and training programs, that process, it really helped me see things differently. It was a phenomenal program. It was very intense, but it definitely helped me get to where I'm at now and really inspire me that, hey, you know what? I can do things. I can help people. So that's kind of my journey and kind of who and why we started everything.
Thank you. There was one thing you mentioned right at the beginning of that I just wanted to follow up on. You said that your dad also, he taught automotive repair in a facility?
Yeah. So when he retired from the Army, because he's a Vietnam and First Gulf War vet, he spent 25 years in the Army, and he got out, went back to school, got his automotive certification, and then was a contractor at the Federal Correctional Institute at FCI La Tuna as a VT auto instructor through El Paso Community College. It was a program that, he went in as a volunteer, or a paid volunteer, I guess you could say, a contract to teach the individuals a tangible trade, which is one of the things that rehabilitation, giving them skills that they can learn while they're incarcerated, and they can go out and then turn it into a job or a career or even their own business. It was basic automotive rebuilding, just how the engines work and those types of things. So he did that for a little while. But it was really because of him working in the environment first and then saying, hey, you know what? These guys say it's way better. And, I would say that he was correct. It was a very good decision for me to go to the Bureau. And as much as I could, I wish I could, do more, because it really did help me grow, give me the time to not only support my family, but get back to school, get my education, and now dedicate myself to this type of work.
That is the first time I've heard about somebody having a family connection to this sort of work, so that is really cool to hear. Thank you. Now we're going to move on to our impact section. So I'll switch it up. I'll put you in the hot seat again for this one, Johnny. If you could describe the impact of your organization and how it most affects the people that you serve.
It's It's simply amazing the impact we're having. So we first began the program at the FCI La Tuna, partly because, my connections to that facility working there, and I was able to present the program. There is a pretty decent sized population of incarcerated individuals there that are Indigenous. There's about 46 to 48. Populations, fluctuates just a little bit due to releases and admits, depending on the time. But we went there and I said, hey, I got this program. I know there's no programs in the Bureau whatsoever that cater to or provide any type of spiritual background for Indigenous people. So the reentry coordinator and myself got together. We held a meeting. We brought all the Indigenous incarcerated individuals there and basically gave them an overview of the program. I told them that, hey, this is a program designed to help you reconnect with your sacred traditions, your spirituality, begin to heal. I told them it focuses on prayer, walking the red road, and the teachings of the medicine wheel. It's a new program and they don't get a lot of volunteers. I just said, hey, just give me and my program a chance. Let me show you what it can do for you. The initial group was kind of small, about 12 people, 12 to 15. It kind of shrank a little bit after that. And we went through the program. It took about 4 months, even though it's only 8 sessions. And partly that was because of the institution schedule, them varying that. And then you always have to have a staff member that escorts you in. And that's always a big challenge. But one of the interesting things with those individuals is there was a young gentleman who's a White Mountain Apache. Towards the end of the course had inspired him so much that he began his journey in sobriety. So, just because they're in prison doesn't mean that they don't have access to homemade intoxicants or narcotics or those types of things, because it's a prison world. So those things are either made or smuggled in. But at the graduation date, he was a month and a half into sobriety, which I think is super huge. So he's dedicated his life that I'm not going to allow myself to be controlled by these chemicals and these elements and these things that are not good for my body any longer. And I'm going to dedicate myself to helping others and doing those types of things. So the last time I went in, which was about 3 weeks ago, he was already on 5 months of sobriety. So he's continuing his journey, even though, I only get to go in there sporadically, but, it was so great to see him out there. He's really gotten back in touch with his roots. He sings, he drums, and it's phenomenal to see that. Another individual in the class, when he first showed up, very quiet, very reserved, and really just didn't seem like he wanted to be there, I guess is the best way to say. He was very quiet, standoffish, and, always had this really grumpy look on his face. But when he graduated, it was interesting enough, the group passed the torch to him and said, hey, we want you to be the facilitator, the main point for the next group, because the whole idea was to enable the community to become self-sustaining. Even the first participants were all trained as facilitators, so then they can go back out and help train the rest of the individuals. So that way, even if there wasn't volunteers coming in, they could still continue their journey in a healthy way with guidance and people that have been through the program. Well, the gentleman really just did a complete 180. He's very open. He's sharing his knowledge because he grew up on the reservation and learned a lot from his grandparents, a lot of the old ways, the old wisdoms, which is phenomenal. And he's passing that freely on to these individuals. And interesting enough, the program is designed where anybody from any group, any tribe can come together, because it just allows people to talk. This is what I remember. This is how we do it. And they learn and they share and they realize that they have the same goals in different things. They're from different areas. So they practice a little bit differently, but their intents were all the same. So it really broke those barriers down. We were also able to get into one of the addiction homes here in Tucson called Spirit Healing. It's a 10-bedroom home for Native Americans suffering from addiction and are trying to get into recovery. But one of the criteria is they have to have some type of cognitive disability. So it's also a mental health type of thing, where they need a little bit extra close supervision and structure. So we ran the program in that one. And interesting enough, there was a young gentleman. He's about going to be 21 now. And when we first started the program, he was very hesitant to even acknowledge us or anything else. Turns out he was a foster child. He has no family. He's been bounced around, throughout his younger years from foster home to foster home. And he was abused very badly. And one of the conversations, he wanted to be included and those types of things. But because of his relationship, he was always ostracized and pushed outside the group. And he wanted to, but he didn't know how to begin to trust or feel welcomed. And, I speak with my hands. So one time I raised my hand because I was being animated a little bit and just saying, hey, look, you're important. But when I raised my hands, he flinched. And it just really broke my heart to see that. But flash forward, slowly, he would always sit on the outside of the circle. He's one of the 4 that graduated the first group. Now he's sitting closer to the circle. He participates a lot more in the group. And he's even got to the point where when he sees me, he'll come up to me and kind of lean his head to the side. He won't reach out to me, but he wants me to give him a hug. So I think it's really great that we're breaking down those type of barriers and saying, look, they're healing that trauma that people go through and giving them a way to go, look, you can trust again. You are loved. You are wanted. You are needed. And we do that through that type of community and making the program, because we do it in a talking circle format, but making that circle sacred and a place where you can be trusted, where you can say what you want to say and not be judged. It's really making a big difference. We're also now in the Haven in Tucson, which is a female residential program and a intensive outpatient program, or IOP site. So they have like 2 different things. We trained about 4 of their staff members to run the program. So we're really excited to see what they come up with and how that's going to go for them. So a lot of great things that we're working on, and we're hoping to expand out.
I really liked how you're setting your students up, getting them integrated in education. And I think just being someone who is educated and who is Native, seeing it is also huge, I feel like, for students to see someone that is doing the job that you want, that's Native, so they can think, oh, I can do it too if they did it,
I'll say that all the time. If I can do it, believe me, y'all can do it too.
Yeah.
But it's not easy. You just have to be dedicated to and say, that's what I want. It's not easy, but it's going to be worth it. It really is.
Absolutely. That representation is so important across the board. And on that, Monica, if you could share on the same question about the WOKA project and the impact that you're seeing on the people that you're serving.
Yeah, I think I want to start by saying something that I find very special working here at Urban Indian Health to first start it off, because working here, we really utilize our Indigenous values of respect, compassion, humility, wisdom, honesty. But what does this all really mean? And I kind of spoke on this on the last question, and it means to be a good relative. So what's really special about Urban is anyone we encounter, so whether that's at our clinic, our behavioral health, our cultural health, our WOKA street outreach team, we call the people that walk through our door relatives. We treat them as so, and I think, when you're providing that medical care or when you're working with unhoused people and you refer to them as your relative, you're going to be treating them as such. And I think it just provides a better base level of care. And I really like that about Urban Indian Health. I think it makes us really special, and I really encourage other Indigenous organizations to incorporate that too. So regardless of the setting that we meet you, regardless of if you're Native or if you're not Native, you're going to be referred to as a relative. So instead of saying patients here, we'll say, relatives here at the lobby. So I find that very special, and I also encourage other Indigenous organizations to incorporate that. So I would say that along with that, what we're able to do, especially the WOKA team, is we've built such a collaborative relationship with our Sioux Falls PD officers, with Minnehaha County, with our homeless shelters, with our other social services providers. We've built this collaborative relationship where we can help our relatives better. Because the outreach team, we've really focused on building trust with our relatives. The first year we were there or out and about, that was what we focused on. So we have this relationship with them, so they trust us. So when they need help or care and they're maybe working with someone else, but if we jump alongside them with that partner, just say the county, we're really able to help that relative because they feel safe with us. We're referring them to other services, but we're collaborating really to meet the end goal, and that is to help the relative. So providing that safe space, I think, has been really impactful, what WOKA has done. And also, we're committed to building relationships with our relatives on the streets, but also our community partners. And I think that's been our biggest accomplishment that we had this past year in 2024 was building that. So creating that safe space, but also supporting our other organizations because, we can't do it all by ourselves. We need to help each other. especially with people that have so many complex situations. It's like all hands on deck to really help them. I feel like that is a big impact our organization has had, collaborating with our community partners, building a safe space, being a good relative, just showing up. I think that's really important for our relatives, especially on the street, is just showing up and showing love, because we don't care if you have a slip up in your journey. We don't care. We're not going to judge you for it. We're just going to be there to support you and help you through it. Everyone has their own journey and what they want to do and what their goal is. If that's to get sober, we're able to help them navigate that, to go through the treatment process, but not just in the beginning, but also when you come back to the community, we're there to be a support. So I think, showing up consistently for our relatives has also been something that our organization has made an impact on with the people that we work with. I think really the biggest thing is being able to show up in the right circle too, because we now have a seat at the circle. And I think that's important, because especially if a lot of our community resources are working to help our relatives and our Indigenous relatives, I think it is important for Indigenous-led organization to have a seat at the table too.
I just want to add that I love what you said. I love the relative. I love the services. I love that we can't do it all by ourselves. And Navajo has it too. For us, it's Himadag. And what Himadag means is that you are a good person, that you do help others in need. What I've found working with tribes around the United States, we all have that thread. And I believe that philosophy of life is what has brought us through all of our hardships, is that we helped each other out. And through the struggles of today and of our history, that's what I believe, that togetherness has allowed us to survive and be resilient. You're exactly right. I think you nailed it, and you're going down the right journey and helping be a solution to the struggles that we face. So I applaud you on that and for being there. And I think that's really a huge thing, is that you guys are present. I really liked your safe space that you had mentioned as well. From us, I think that's what's beautiful about the Wikla is that, we are all coming from different strengths. For example, I'll just say a little bit of the Wasatch. On that one, we're looking at taking what you just mentioned, saying, how do we try to find the solution? How do we keep them out of this system? And how do we, if they are in there, try to not let them lose that culture and that language, which is so strong in getting through tough times? Mm-hmm. And then also, how do we keep you guys out of this once it happens? With the Wasatch, what we do here is going out to the tribes, the local tribes, because the Tohono Nation is here, and they're big, 2.8 million acres, Standing Rock and the southern area. I mean, you guys are huge as well. So we're trying to look at the grassroots and trying to plant these seeds in these children's minds, because, for example, for my tribe on the west side, we still live in villages. I've been at Standing Rock. I know how that is as well. Very similar. In our village, we have like maybe one faucet that's going to support the entire village. In those areas, the culture is very strong. What we do is we're going to the people themselves, because, for example, in the west side, as I mentioned, they don't understand the concept of like a nurse or doctor. They don't get certain things because it's not a part of their everyday life. And many of the people on the reservation have never even left the reservation, like me. I didn't know what a college was. I didn't know what associate's degree. I had no idea. That wasn't a part of our lives. So what we're trying to do, at least where we are here in Arizona, is really trying to work with the tribal community college. We have the Navajo Nation College. We also have the San Carlos Apache one. So we're trying to plant seeds of what is a doctor, what is a nurse. And for example, this summer, we're inviting those students and also the workforce, the one-stops, the vocational rehabs. We're taking those adults, trying to get them jobs to now focus in with the youth. And we're going to introduce them along with the Tohono Community College, the San Carlos Apache Tribe College, the Pascua Yaqui. And we're working with the departments at the University of Arizona, like the College of Medicine, the College of Nursing, College of Veterinarian. These are what tribes are saying we need on the reservations. We're also incorporating traditional culture and language. This has been only 2 years in existence with the Wasatch Center, but we're looking at the children, we know they're important. And even the adults who are trying to get on their feet, many of them don't have the confidence. Many of them say, gosh, you know what? A nurse? Not only do I not know really what that means, but I don't know if I can do it. They have that lack of confidence. So what we're trying to do is marry with them entering into these lower level degrees and giving them the assistance that they need to make sure they're going to get through it successfully. mentally, there might be people who are coming, the tribes that are coming and they have ceremonies. It's very impactful not to be able to be a part of that or can only go to some of it. Well, we're going to be there to tell the U of A, hey, listen, just like you guys have your ceremonies you guys got to do and you take that day off. Well, guess what? They do too. And they need to be respected and acknowledged that they have to leave and they shouldn't be penalized from that. So it's like you had said, Monica, being an advocate and being a voice.
Thank you both so much. So I'll go ahead and go into the second part of this section, which is speaking about impact. Has your program impacted justice involvement of the population you serve, either directly or indirectly? I know we've already discussed things like preventative healthcare, mental health care, and education, which obviously do tie into justice involvement. But if you wanted to expand on that or any other linkages that you're seeing, I would love to hear more about that.
Sure, I can start. So, like I said, we do provide an alternative to calling the police for like these low-level, low-risk calls, which would be an example, say someone's like panhandling or maybe intoxicated sitting against a building. They're asked to leave, but they're not leaving. They could give us a call and we would go there and kind of triage like, hey, what do you need? And a resource that we utilize is the Link, and it's a community triage center in Sioux Falls. So if someone is maybe under the influence of something, we're able to take them to that triage center so they can be safe. So if they're like napping somewhere, like on a bench, and they're like, well, I need to get money for a room. Like, well, have you heard of our shelters here? Have you been connected with XYZ in our community? We're just able to be that resource and spend more time than the police were able to do because they're not social workers. So we're able to do that and spend more time with people and figure out what they need. But also when we're doing outreach, I can just think of one example of we met this relative at the library because that's where our relatives we work with, they hang out there a lot, you know, applying for jobs or just cooling off. It's like a safe place for them. And we met this relative who had recently gotten out of prison, had said, yeah, I'm supposed to get in contact with someone from Sisseton. And we were able to sit down with them, figure out who that was. They are actually supposed to go to the halfway house in Sisseton. And that PO person was looking for them. They didn't have any way to get a hold of them. This person was new to Sioux Falls, didn't know where the resources were. So we were able to provide that connection and actually get them safely there so they didn't get in more trouble. The population we work with, unfortunately, are highly impacted by the justice system, you know, because you can get a ticket from just sitting in a place that maybe you're not supposed to. So yeah, a lot of the people that we work with are justice impacted. Like I said, we are involved in a lot of community collaborative meetings where we address the like high needs population or people coming in and out of the jail system, or we kind of brainstorm in how we can help them as a community.
That's great. It's really great. Yeah, I remember something that sticks to my head when I was out at Standing Rock, the north side. There's a lot of young people who they go and they drive, and then when they get off, they get caught because they don't have a license. So now they're suspended, and now they can't get a license. So now they can't go off and get a job over there in Bismarck, for example. And it's just like, it doesn't end. You know, how do we get them licenses? Maybe we do look at ways of transportation, but in a perfect world, how do we get them the resources to go get their license and GEDs and things of that sort? You know, at such a young age, many of them are already impacted by the justice system just in that alone, you know, because then it's going to impact, I can't get a job, I don't have a car, I don't have a license, so many other things that doesn't give them a great start. And they're just so young. So with that, ours is a little different because I would say that a lot of times we deal a lot with trying to create systems, trying to figure out how do we create a system within a tribe to make it so that that doesn't happen. For example, we deal with a lot of our collaborators. I deal with two. I sit on the Pima County Board of Supervisors and trying to work with urban Indians there at Pima County regarding the opioid settlement. We have a lot of urban Indians as much as we have on the nation. People say, oh, but the tribes have their own settlement money. Yeah, they do. But you need to understand that tribes also go off and on all the time. They are not settled on the reservation. You know, if they have a baby, they have to go off the nation. And then if they have to go to school, many go off, but they live on the nation. So it's not like urban Indians, oh, that's it, urban, they're just stuck there. That is the case in some respect, but it's also a lot of the tribes going back and forth for ceremony. So on the reservation, that's one thing from my experience I had to teach the board of supervisors is that it's not like we're dealing with urban and that's it. You're going on and off for services that we can't afford. And I know that's the same, at least for Standing Rock North. And also something that you mentioned, Monica, was about we try to be there if there is triaging, right? So if you find a mother who has opioids and now she has a baby, you can't just take that baby. Now you got to deal with ICWA. So there's just a sense of 101, or having somebody from either a tribe or having a tribal person who understands, who gets it, what have you, who has that lived experience that you mentioned to assist in that triage when they do go out. That's another way we are trying to help change that system. And also they're trying to create grants out of that money, for changing that kind of system. But I think more importantly, what Monica had mentioned is that really being at the table now, because there's times, like I just mentioned, when we were at the table, just being there, it's basically to enlighten people. And it's challenging. And I always use this phrase that it's like trying to teach a blind man about color, the nuances of being a tribal person that are not easily transferred over here. At least in Pima County, as a group, we're number one leading in not only opioids, but drug use or even death here. Our tribal people, they're dying. ICWA, having our kids taken away still. So this still exists, but everybody thinks, oh, well, why can't they just convert and assimilate? Well, it's different. And that's why it's so important to, have tribes at that table, trying to create these systems that we know we need at the level of incarceration, tribal or non, so there's some people that are really good people. So we deal with the court systems, the Pima County Juvenile, Pima County ICWA. On that one committee I sit with the opioid, we have the police represented there and others. So we're really trying to figure it out. And just being at that table, Monica, just being that voice of us, it matters so much.
I did just want to follow up. Sorry, what was the judge that you mentioned you had a good relationship with?
Oh, her name is Judge Quigley and Judge Bostwick. They are champions for the Indian Child Welfare Act, and they go all over the United States trying to assist state courts, trying to help them have the system of when you do have an Indian child, what does that mean?
Gotcha. Thank you. And then I also just wanted to follow up. You said that you worked in the juvenile justice system. Are you able to expand on that as well?
Yeah. So as a law clerk for a judge, a judicial law clerk, I oversaw what they call dependency cases. I was in an ICWA court, so it was always Native. So at the same time, I also dealt with not only dependency cases, ICWA cases, but also delinquency cases. So ICWA does not apply to delinquency. If the child is a delinquent, then ICWA does not apply. So where I was a jail, basically, for the juvenile. The majority, again, were Hispanic, but mainly Native American. Again, that was one thing I know when I left. I stayed 2 years and helped create the ICWA court. But that was something that I think we're still really trying to address. They just ignore us. They're not seeing that we are there as Indigenous people. My people, the O'odham, they're there. The majority of them are O'odham, but yet it's just that vicious cycle. We have to look at those children. They get caught in this ICWA, but a lot of parents that deal with Native kids, they end up putting them in these group homes. Well, guess what? They run away and they get delinquent because nobody ever cared about them. Somebody had this bright idea to take them away and not have them be with their culture and their people. And so what? They're getting in trouble. So now they're getting into drugs. It just is this vicious cycle. So a lot of kids that are in juvenile detention, even on our reservation, they're there, but they don't know how. This is my last thing I want to tell you. I come from a family of criminals, man. I'll be honest. I was so embarrassed that when I was working with the prosecutor, I wanted just to see what those people are doing, the prosecutors. Let's just say if I ever go to prison, I'm not going to be lonely. I'll have a lot of family there. For my cousins, they're going already in juvenile. They already are there. And they're just like, well, what does it matter? My uncle says, you might as well just get used to it because you're going to be a part of the criminal people anyways. That's what we hear. We don't hear like there's another way we can go to school. It's just, this is just what is normal. And that's not what it should be.
Yeah, and again, the point of this podcast is to get a robust view at the work you guys do. We're trying to see all the different things that play into it and get the full picture. So exactly what you said, it all feeds into each other. You can't just look at one part of the issue. You have to look at childhood, healthcare, resources, everything. So absolutely, I appreciate you sharing that with me. And speaking of that, moving on to Johnny, this one will be a little more direct for you, actually, since most of the people that you're working with are already justice involved and inside facilities. But can you talk about the impact that your organization has had with the people that you're serving inside facilities?
Even though we're serving those individuals that are already incarcerated, many of the individuals that are in the recovery homes have also been just an impact. And part of that is hoping that they get through the program and don't go back to their old ways and reoffend. But it's also given me an opportunity, especially with FCI La Tuna. I've been able to reach out to, we connected kind of oddly. It wasn't planned or it wasn't like that. But one of the individuals that's there, his aunt is part of the tribal health organization that they have. But we met up in a conference and we were able to discuss some of the things that were going on in the prison. And it just really brought hope that her nephew was really trying to make a difference, that he is working very hard to do things correctly. And so with that, I think we're able to bridge back and help family members see that, look, you know what? Yes, your loved ones have committed these acts or done this, and time after time they said they were going to change. But now I'm a third party being able to say, look, this is what I'm seeing. This is what they're doing, and being able to relate direct stories of personal growth, which family members don't get. And prison systems don't do that. That's not in their practice. Those type of information exchange, I think, is something that's lacking that could really help reform and rebuild family ties and really build that stronger community. So I'm honored just to be able to share. The gentleman that's facilitating the class, his daughter is also very active in the community, and, she's a doctor herself. And we did a separate panel for something totally different. And that's how I met her. And it was just really weird how involved in this work, but it's connecting me with people that are directly impacted and helping them say, hey, look, you know what? There is hope. There is a way, and we can make changes. So we're making a huge impact.
That's fantastic, Johnny. Thank you.
For our last section, we're going to talk about resources. We've talked a lot about the work that your organizations do, but what resources have been the most effective in supporting your organizations and the people that you serve?
Resource-wise, we're a small grassroots organization. We're a total of 3.5, sometimes 4, just depending on what happens. But we're very dedicated to the program. And what we appreciate is just really the networking, the ability to go to these conferences and just the support to help us get there and share. When we were able to get up to a healing conference in Ignacio, Colorado, just this past month, and we were able to connect with tribes and various tribal organizations and individuals from across the country from various different tribes and say, and share our story and share our information and go, look, this is free. We'll train you. This is what it is. The small cost is just for maybe the books if you want them. But even then, that shouldn't be a deterrent for us to give you this program and let you run it. And it's so great because it's a very flexible program. There's no structures, and anybody that takes it can then adapt it as they need to and interject their own specific ceremonies or anything that they wish to. But it's really just getting people to talk about what they have. So I think just being able to get out there, the exposure, the support to be able to get to those places, because, the cost is always something that's very difficult to deal with, especially when you're trying to do something. And even though we're not a nonprofit yet, that is the direction we're trying to go. And, we're hoping to completely do that because we're not in it for the money. We're here to help people heal and do it the way we need to do it as a community, and through just sharing our experiences and our knowledge and doing what we were meant to be, and just taking care of each other as people.
Thanks, Johnny. Monica, if we can go to you next.
I think for our street outreach team, it's really being a part of a clinic is pretty cool. I think that's unique as an outreach team. So if we come upon someone that needs medical services or that preventative health care or behavioral health, we have counselors, or if they're wanting treatment, we could schedule them with one of our counselors to get that treatment needs assessment. And we actually just had a nurse psychiatrist, nurse practitioner, so she can prescribe meds to our clinic too. So that's very helpful, especially people who need that long-acting medications too. So it's really cool that we were connected to or within the clinic, so that continuity of care. And then having a cultural health team as well that have Red Road talking circles or well variety classes or Lakota, Dakota song, language, drum group. Being able to refer our relatives to our clinic so we know who they're going to. Like, yeah, our counselor is really cool. You can trust them. Or we have our cultural health people here if you want to go and talk with them, or if you want to join their beading and sewing, if you want to get immersed in your culture. We have these options within just our clinic, which is really cool. But also our community partners are huge because, like I said, you can't do it alone. There's another street outreach team who consists of medical doctors that volunteer. So them being able to check on people because people don't always show up, even if we're going to provide the transportation for them to get to an appointment. What happens? They don't have your phone or your calendar to remind them, so even if we're like, hey, we'll come pick you up tomorrow morning at this, but they may not make it. And that's fine, because then we have this other resource that's on the street and be like, hey, they're doing rounds Sundays and Mondays. Make sure to go get seen by them. So we really heavily rely on them. And then, of course, Minnehaha County, their Human Services Department. They have the Alliance program that's for people that are in and out of the justice system. Being a part of those meetings that we can collaboratively work on these complex cases to, everyone can help case manage. And then we're also a part of the shelters meeting that happens. So that's with the homeless shelters within our community in Sioux Falls. So we attend that too. And then I talked about the Link, which is that community triage center. So they have your sobering. So if people need a safe place to sober, they also have the medically monitored withdrawal management there. So if someone's wanting to say they're not sober, but they're wanting treatment and they want it now, they want to withdraw. And, that's not safe, especially if it's alcohol. They can go there, and if they have a bed available, they can withdraw medically there and be watched, and then they can get their treatment needs assessment, and then hopefully a bed date. So that's a huge resource in our community. The city of Sioux Falls and Sioux Falls PD, really, we work with them, and they care about our relatives on the street, too. Sioux Falls is really unique that we all talk, like the city, the county, healthcare, hospitals, the shelters, we're all connected and we work together. So I think that is something that's unique about Sioux Falls.
I think that's really great. And for the Wasatch Center, I think one of the greatest resources that we have are the tribes, are the people, their voices, their assistance in helping us create this. That right there is first and foremost the greatest resource that we have, is we have people that like Monica, that are at the table and their hearts are good people and they want to help their people, our relatives, doesn't matter what tribe you're from. So I think they are the biggest resources because, like she said before, we can't do this alone. We just have to rely on each other's strengths that we have and their experiences. All of us are different, but we have to acknowledge that. And then another resource that just comes to mind are organizations like the MacArthur family and JMI, just like you, and others that really have their heart in the right place to help people that are struggling and need assistance. Like she said, we can't do this by ourselves with it's such a big bear, right? That we know we need is help.
I feel that trust, especially coming into Wichowyanke and coming into these Indigenous spaces. It is not a trust that we take lightly. It's always an honor to work with organizations like these. So I'm thrilled that we are able to contribute and that the work that we're doing and projects like this podcast are helpful to you all. And that brings us to the final question of this episode, which is, how does your organization hope to grow in the future?
So one of the things we're going to do is we're working on transforming Sacred Traditions into a nonprofit so we can seek out additional funding. We are already approved to run Sacred Traditions in the Arizona Department of Corrections, all the prisons statewide. And we're partnering up with another company called Justice Communities Arizona, I believe is the name. And we're going to run a free training and put it out there and see if people want to come out and, spend a day with us. We'll train them, give them the materials, give them some workbooks and show them how to run the program them and then send them back out into the community. So our goal is really not to be just a sole source, but to build a community of facilitators that then go back out in the community. Similar to the ripple effect, we just want to train people and just be there to support them, and we make changes. We can reach out to them and go, here you go. Here's the new stuff. Please continue on, because that is the goal. Getting help, you would think it'd be easy, but it's so difficult. And so we want to change that narrative and say, no, we are here. We will help anybody. We will go anywhere that we possibly can. If it fits in with our means, that's what we want to do. And we hope to bring more folks on to help us spread the word and travel, hopefully nationwide or worldwide, whatever that may be, just giving people some hope. That's what we hope.
That's beautiful. Thank you.
So I do want to reiterate that OKA project wouldn't have been able to start without the Safety and Justice Challenge to pilot us. So we appreciate that. And this kind of leads, I'll just focus on OKA itself and not Urban Indian Health as an organization, but how we hope to grow. So we're actually going to be able to use the capstone funding from the Safety and Justice Challenge to hopefully hire a part-time case manager. We just set out a job opening or description for that, and that's something that we realized that we could really utilize on our team, and we wouldn't be able to do it without the SJC.
And I echo what Monica just said as well with some of the funding that we have from you all in creating this. I like the fact that MacArthur and JMI, they trusted the fact that we're going to change Wasaja's money and then we're going to create it so that it administers to the entire United States. It's almost like you guys passed the baton to us as Indigenous people. And now it's like, okay, let's see what you guys can come up with in trying to help and what we can do. And I think that kind of trust we're so grateful for that. Where do we go from here? Now the Wasaja, we're moving, nationally, a bigger space. And when I was doing research, when trying to create the Wasaja, we had looked at Johns Hopkins and things. And yes, they have tribes and tribal things, but it's not tribally led. That's the biggest thing, is that we do have doctors and stuff, but we also have people who are council people who are directors of the tribe's education department of their workforce. We have all kinds of people. We have judges that sit on there, social workers. So we have people who are giving their input. We are hoping to also look at, because we are a land grant institution, what that means is that the university receives extra money because of the tribes, which are the O'odham and the Pasqua that lived there. We're going to tap into some of the funds there to help fund us as well, because we're looking at our sovereignty, looking at the tribes, right? So I have to look for grants to fund everything, right? What's challenging is the fact that we don't have data in Indian country for things. How do we give the tribes the ability to say, this is the research or the data we want, and we want this institution to give it, and we want that person to give it, but that's ours. There's data we want to be able to know. How do we do the data ourselves? It hasn't actually been done yet. And I think once we have a template, then we'd be able to share it. We want to expand that area of really trying to protect and having an appreciation for the sovereignty of these tribes. So we're going to be looking in regards to more grants. I don't get them because I don't have the data that proves that what we're doing works. I want to help give people the voices and help them to help our relatives the most I can and create these systems that will be protected when I am gone. Now we have a staff of almost 10 people that are all native and they know the nuances of this. So we're growing our people now. We are expanding within 2 years. We have expanded so much. And so we're growing in leaps and bounds, even without, I guess, the finances or the money. Eventually, I hope we do get it. But now I think it's tapping into us, into our tribes, we can do this. We just got to figure it out how.
Thank you for listening to Just Conversations, Indigenous Teachings for Recovery and Reform. This has been Episode 1, The Lay of the Land. In Episode 2, The Changing Landscape, we'll discuss small and large-scale developments in criminal justice systems and how Indigenous organizations are responding to change. Thanks to our speakers today, Christina Andrews with the Carlos Montezuma Center for Native American Health at the University of Arizona, Monica Bailey with South Dakota Urban Indian Health's Wo'okia Street Outreach Team, and Johnny Chavez with Voices of Change's Sacred Traditions Program. We would also like to thank the John D. and Catherine T. MacArthur Foundation's Safety and Justice Challenge, whose support makes initiatives like the Wichayonke Network and this podcast series fit possible. Once again, I'm Wynne Mackay with the Justice Management Institute. We'll see you next time for Episode 2, The Changing Landscape.